Mark in Chiang Mai, Thailand. I've been to Chiang Mai. Hey, Mark, welcome to the program.
Yes, Thom. It's a wonderful city. How long ago were you here?
I was there in '99, as I recall, last time. I spoke at a conference
99.
there,
Well, a
actually.
lot has changed since you've been here. I was first here in 1970 or very early 70s, and I don't even recognize it.
Wow.
But it's still a wonderful city. And
Yeah. We
let me tell
also
you,
we also we also traveled from there over to the Burmese border and visited the refugee camps for the Karen refugees, the indigenous people of.
probably over by the Mahon Song border, out in that direction.
Yes.
I've taken that trip quite a number of times on my motorcycle. It's a beautiful trip.
Yeah.
In the early 70s, I was dealing with the Burmese government and always had to have a state-sponsored minder with me, and I could only go between Rangoon and Mandalay, but I always had to have
Right.
as I said, a minder with me.
Well, I'll bet you have a repository of interesting stories, but that's not what you called about, Mark.
That's not what I called about. I can understand to a certain degree, where adjustments need to be made in either Medicare and how it's paid out. But what I really don't understand is, and there's 2 points I'd like to make here. President Obama has, I believe, openly stated that he does not feel that Medicare payments should be made to any facilities outside of the United States of America.
Okay, I haven't heard that specifically, but I'll take your word for it.
Well, currently, Medicare payments, I don't believe, can be made. However, if you're a member of the Veterans Administration, the U.S. government, there is what is literally a 5-star hotel hospital in Bangkok by the name of Bumrungrad, that if you are, as one of my friends is and lived and worked in China, ill, he was flown, or he could fly to Bumrungrad, and the U.S. government, Medicare, his Veteran Services Agreement, would pay for it. It
Right.
is a fantastic facility.
Right, and I understand that this actually factored into. I may be wrong on this. It's third-party information, and I haven't asked him directly. But I understand that this factored into Jesse Ventura's decision to move to Mexico as a former Navy SEAL. That he
quite likely
he's got VA insurance, and if you're French or I know France for sure. I don't know about the other countries of Europe, but if you're French and you're injured outside the country, they will pay for your health care. And they just pay it.
I'm sure that's quite true.
They just write a check for it.
I'm not certain with other countries. I don't think Australia is that way, and I'm not sure about the UK. But I mean, in Chiang Mai, this is a world-class medical facility, a medical destination for all of Asia. In fact, IBM has committed some $50 million, which in this country is more like 500 or $500 million, basis cost of living and what you get for your money, to creating a better infrastructure for medical services in this country.
Right.
Many of the doctors and specialists in this country are trained in the United States, board certified in the United States, have all the medical training one could possibly need, be it from internal medicine to dentistry to virtually any medical service you might desire. Right. It is available here. It is available right now at roughly 25% of what it would cost in the United States for top-notch services. And believe me, I'm 60 years old. I've taken advantage of them. I wish that at some point, Medicare services, and if I'm 60, I'm not yet 65, obviously, but I would hope that they would be available to me, because Medicare would be able to save a ton of money if payments could be made to this country.
Right. If you had to move back to the United States because of Medicare, your cost of medical services would go up 75%, or actually go up 300%.
Absolutely.
And, yeah.
I could go in. I can go in for a root canal and a crown on a tooth here for $400.
Wow.
That would cost me $2,000 easily plus in the United States. At least last time I did in San Francisco. Right. And I've recently had hernia surgery. Quite inexpensive. A private room overnight. Very inexpensive relative to the United States.
Okay. Point made, Mark. And it should be a consideration. It should be part of it. And like the French, we should say, hey, if you're an American citizen, you're covered. Now, here's the flip side, though.
No.
Do you, when you earn money in Thailand, do you pay in? You don't pay into Medicare, do you?
I don't. Well, I don't earn enough to pay income taxes at all in the United States. I'm virtually retired, and quite honestly, I earn a very small amount of money from my U.S. clients. I do AutoCAD technical work, but $1,000 a month, I live very, very suitably. So it gives me $12,000 a year, and that's certainly not enough for the government to be concerned about me.
Right. But I guess the question is, should expats, and I don't even know how the French deal with this, should people who have spent much of their lives as expats be eligible for the National Health Service if they didn't pay into it?
I know there are certain qualifications. I'm not certain about the French because I don't have that much. The French expat community is not that large here, mostly Brits and Australians and Dutch, but I know that in many respects, the pension funds that are available to the English or the Australians is substantially reduced if they do not spend X period of time back in their home country.
Right. It does make a certain amount of logical sense. Just a quick question, Mark, before you go. What is the Thai healthcare system like in regards to providing health care for everyone in Thailand? Do they have a universal health care system?
For everyone in Thailand, one of the notable changes that former Premier Thaksin, who was later convicted of corruption charges, but his sister now has taken control, and that party has taken control of the country.
Right.
One of the major things that he did was institute a national health care program that any citizen could go into a government hospital and get services for $1 per visit.
Wow. And that earned him, as I recall, the hatred of the very wealthy class in Thailand. There are conspiracy theorists, correct me if I'm wrong, who suggest, and maybe they're not conspiracy theorists, who suggest that the reason Thaksin got prosecuted and run out of the country was because he had basically done a Chavez. He had turned the economy of the country from of, by, and for the rich to of, by, and for the working people. Is that an oversimplification?
Well, I mean, there's a lot of controversy about that. I live out in his home district, just outside of Chiang Mai, and I've spoken to a number of local Thai people who very quietly, sort of under their breath, say, Thaksin was really not good for this country. He really was by and for Thaksin. And his family and his family businesses. Yeah. There were a lot of corruption, and even to this day, it is widely known. It is widely expected that we just had national elections last week or the weekend before, and politicians will go out and pay 300 baht or $10 if you vote for Thaksin's sister's Yin Luk, or if you vote for Abhisit party, we'll pay you 500 baht and so forth and so on. So votes are being bought left and right in this country. So it's kind of like who has the most money to buy the votes, which is unfortunate. But that's just the way it is.
And there's no prosecution. There's no prosecution or oversight of that, and there are no electronic voting machines. So
not really. It's kind of tape. It's been what has been done for decades. Yeah. So it kind of continues. Thaksin's party is the party of the poor, but it's like it's hard to describe, but it's a lot of the policies are said to be for the poor, but they don't really. They just put the poor more in debt. They feel like they're better, but they're just more in debt via loan programs and so forth that the government put together for them. And it's a rather long, convoluted study that deserves far more time than I'm sure you're willing to give to me or able.
Or able, actually. And plus, I'm not sure that most Americans are all that interested in Thai politics. I am. I've been there a number of times. I was there during one of the revolts, actually, when the military took over. Anyhow, Mark, thanks so much for calling from Chiang Mai, Thailand.
You're very welcome, Thom. Pleasure. Always a pleasure to listen to.
Thanks for listening to the show on the web. We'll be right back.